Welcome back. A health alert now to a groundbreaking study that could change the way doctors treat millions of people living with Alzheimer's disease. Researchers have just identified 4 new genes they say increase the risk for Alzheimer's, and that discovery could one day lead to better, more targeted treatments for patients of Alzheimer's. Want to bring in family physician Dr. Jennifer Caudle. Doctor, good to see you. You and I have spoken about Alzheimer's before, so how significant are these new findings?
Well, I think it's very significant. And first of all, let me say that Alzheimer's affects so many of us. As a family physician, I treat patients with Alzheimer's all the time. I have family members of my own. Millions of Americans are living with Alzheimer's, and it not only affects the patients, but also the caregivers. This study was very important, but because it included over 94,000 people. It's one of the biggest studies about Alzheimer's that we have, and it included study participants and researchers that were literally from around the globe. So this was really, really important. This study actually reviewed more genetic data than any other Alzheimer's study that we've had to date. So I'm pretty excited about it, and I think it's really a move in the right direction.
It's in my family as well. We discussed that. So would it lead to more preventative ways to, if you have the genes for this, to not get to that particular point, to slow it down, the process, or eliminate it altogether, of course, is the goal?
Right. So, well, certainly that is the goal. You're absolutely right. This particular study, what it was doing was it was kind of honing in and drilling down on some of the genetic factors that increase the risk for someone to get Alzheimer's. That's what this study did. That's what this study showed. Now, it's really, really important because, as you mentioned, what we're hoping is that the data and understanding these risks and these genetic associations and these genome-wide associations will help us develop therapies for Alzheimer's disease, but will also help us just understand the condition much more than we do now. That's something that I'm really, really hoping for. And I have to say, I'm encouraged because I feel like every day or every week we're hearing more and more and more about different studies and research happening about Alzheimer's. I think I've told you before, I'm hopeful that we're going to really make some progress and headway. I think we're doing that already.
And some contributing factors, age, family history, of course, head trauma was in there, and also heart health.
Absolutely. So when we talk about the risk factors for Alzheimer's disease, we think that genetics definitely plays a role, but we think other factors do as well. You know, one of the big things is, you know, family history, yes, but also things like heart health, your cardiovascular status, how well your blood pressure is controlled, diabetes, strokes, other things like that. And I think a lot of people don't necessarily understand that all these risk factors can play a role in Alzheimer's and dementia in general. So it's, you know, one of the things I often try to say, I always try to give people hope. You know, sometimes we watch or listen to these segments and we say, well, okay, well, what does that mean for me now? We're hopeful that we have more information about Alzheimer's, but what it means for us now is all the stuff that we always talk about: living a healthy life, eating properly, exercising, keeping your heart healthy, going to the doctor, keeping that blood pressure under control. That stuff matters, not just for the heart, but also for the brain and other organs as well. So that's some take-home things that I hope people really understand that we can do.
It is certainly promising in terms of the groundbreaking discoveries they continue to make. Dr. Jennifer Caudle, thank you.
Yes.